I'd like to call to order the Lane County Board of Commissioners, our regular meeting for Tuesday, September 15th, 2015. And the first item is adjustments to the agenda, and I'd like to pull from the consent calendar completely, not to be discussed separately just because it's not ready. Item 5A1, it will come back to us probably in a following week. So item 5A1 is not included in the consent calendar. Are there any other adjustments to the agenda? Seeing none, I just will note we have some time certains today, including a time certain executive session at 1:30 and a fairly full agenda, so I'm going to try and keep things moving along this morning. Public comment. Do we have anyone signed up for public comment? Can somebody take a quick... No one signed up? No one wishes to address the board, so we'll move past that. Commissioners' response to public comments and or other issues and remonstrance. Any remonstrance from the board? Seeing and hearing none, is there any emergency business this morning? No. Then we'll move on to the consent calendar, less item 5A1. Is there a motion to approve consent calendar? Commissioner Stewart.
Mr. Chair, I'd move approval of the consent calendar as amended.
Second.
Been moved and seconded. All those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. Which gets us all the way to we'll skip over our time certain and move to item 6B in the matter of awarding and accepting contracts and amendments and delegating authority to the county administrator to sign and approve contracts and amendments in the Department of Health and Human Services. I'll talk a little slower, Alicia. I'm sorry, we moved really fast through those first items. So we have Alicia Hayes with our Department of Health and Human Services Director. Turn it over to you.
Thank you very much. Trabozovich, sorry I'm a little tardy. We had the United Way breakfast this morning, and I didn't want to get a speeding ticket.
Why do they have those at LCC? I mean, it's crazy. I love LCC.
See, but it's a quick drive back. So today we're just talking about a new contract. This is an extension of agreement with United Way to provide Triple P, which is Positive Parenting Program Services. This is money that we receive through Trillium, through our prevention money, and the contract amount of $164,000 for a time period between 9/1/15 to 12/31/18. In addition, it's amendments around Cocoon and the CHC, or the Peace Health purchase of prenatal lactation and case management services through the CHC. Questions?
Any questions for staff? Commissioner Lykin.
Thank you, Mr. Chair. Not necessarily related to this action item, but because you're here and under Health and Human Services and contracts, and this is something I may ask at the end of the meeting when we have opportunities for potential work sessions, but is there I guess I'd like to ask you before I ask this question, and that is there a chance that we might be able to have what I would consider maybe the new leadership, what's happening with Trillium and that whole, if we can maybe get some idea of what their goals and so on and so forth, because, you know, when these CCOs were set up, the idea was to work with community-based healthcare providers, and Trillium now has been swallowed up. And so I guess I'd ask that question, and then I would, at the end, maybe ask for 3 head nods if we could get to that point.
Commissioner Lykin, Commissioner Trabozovich, Commissioner Lykin, it would be our pleasure to do that, to provide the opportunity for time for you to talk with the new leadership and with probably be the old leadership, because they're the new leadership with Terry Copeland.
There's no leadership change.
There's no leadership. Okay, I'm not going there, Commissioner, but we would be happy to. And I think it's really important. We have a very strong relationship with our CCO. We've got Trillium Behavioral Health. We've got our staff over there to talk with you about the changes and then about some of the opportunities that have come forward because of this. So.
The only reason why I bring this up is I've had some conversations with some local physicians who are a little antsy. And because Trillium, this was a community-based operation, and not to say that the Trillium that is located here is not community-based, but when you potentially could have decisions being made somewhere else, that's why I'd like to just have that conversation. I know Commissioner Farr is probably a little bit more engaged with this, obviously, than I have been, but I think just from a business standpoint, I think it would just make sense just so we could have just that conversation, just to kind of see where things look in the future. And like I said, this has nothing related to this agenda item, but because I had you here before I would maybe potentially look at the three head nods, I just wanted to ask that question, so appreciate that. Thank you.
Commissioner Rosevich, Commissioner Alikins, Commissioners, Steve reminded me that we have a work session next Tuesday afternoon, I believe.
1:30
and I don't
time certain.
Pardon?
1:30
Time certain.
Yeah.
And I'm not sure I could take a look at the agenda and see if we could fit in maybe a 15, 20-minute discussion, or if you're looking for more, we could try to find another time, but it might be timely, even just to give you an update and see what we could
Well,
do.
an update would be fine, and but again, I'll leave that to our agenda-setting team as well, and see if they're comfortable by adding that, but that would be a request that I would have. So appreciate that. Thank you.
Commissioner Stewart.
Thanks, Mr. Chair. I just wanted to add on to Commissioner Likens' request. I would support that request. I, too, have received some concerns or just some cautious apprehension about where it's going, and I know that I've expressed this with Karen, and you have also, I think, in our last update, gave us kind of a little bit of a status, but the providers believe that we're kind of should be and need to be there to make sure that everything's going appropriately and kind of be their voice. So I would support that request. Thanks.
Change always creates stress and apprehension, so it'd be good one of the ways that you get rid of that stress and apprehension is with information, so it would be probably a good thing to have that discussion maybe publicly so people can hear that and have that information. So when we get to agenda items, we can bring it up again, but I see a need for that. So getting back to the item before us, I just want to note real quick that all three of these items basically deal with providing better conditions for children in our county in various ways, and it's just another example of the variety of services Lane County provides to the public, through different various mechanisms. But it's just, all three of these changes in the contracts and grants are basically focused on children in one way or another, and I think it's just a great thing we're doing. So do we have a motion? Commissioner Stewart.
Mr. Chair, I would move approval of Order 15-9-15-10 on the matter of awarding and accepting contracts and amendments and delegating authority to the county administrator to sign the approved contracts and amendments in the Department of Health and Human Services.
Second.
It's been moved and seconded. Any discussion to the motion? Seeing and hearing none, all those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. Thank you. And seeing it's not 9:30 yet, I'm going to jump down to item 7A, Public Works. And in the matter of authorizing the sale of county-owned real property for $150,000 pursuant to a land sales contract to BJ Real Properties, LLC, for 27 lots on Roaring Rapids Way in Oak Ridge. And we have Jeff Turk, our Property Management Officer, and Howard Schuessler, our Assistant Director of Public Works. So, welcome, gentlemen.
Good morning, Chair Bozovich, members of the board. The matter before you this morning is the county has received offers on properties that we acquired through tax foreclosure. Brief history, the county foreclosed on 29 lots in the in the Simon Creek subdivision up in Oak Ridge. They were offered in an auction this past April. 2 of the lots sold at the auction. There's 27 lots remaining. BJ Real Properties has submitted an offer of $150,000 for all 27 lots. Their offer is $75,000 down upon acceptance by the county, and the balance to be paid within 6 months of execution of a contract. Also, an offer received for 1 lot, which is just under an 8-acre lot that was designated as Lot B in the subdivision, which typically indicates some sort of common use. The offer was submitted by Jeffrey Mollers and Kimberly Buckmaster. Their offer was for $6,000 with a $1,200 down payment, and the balance to be paid in 8 monthly installments of $600. That property was offered for $8,000 at the auction. So the offers are being presented to the board for their consideration.
Commissioner Stewart.
Thanks, Mr. Chair. Mr. Turk, thank you for coming today. This item was scheduled for consent calendar. I asked that it would be removed only with the intent that we did have a public comment that they wanted to submit a bid, and I knew that there was possibly a couple bids, and really just wanted to make sure that this was all, the explanation out in the public that, these are the 2 bids, what we were considering, so that it wasn't just a consent item approval. So thank you for taking the time to
Thank you.
do that. I guess I did have one question. You indicated that the 8-acre parcel had it was common area.
Well, it's unclear. Typically, it was designated in the plat as Lot B. Typically, when a property is designated as Lot A, Lot B, Lot C, that typically indicates some sort of common use, whether it's a common area, whether it's easements, things like that. And prior to the auction, did some research and couldn't find anything that said to the contrary, that it was or wasn't supposed to be a common area, but, not to advertise it as buildable. So there's some conflicting information from the city of Oak Ridge as to whether you can subdivide it or not. And so it's still unclear whether it's supposed to be common area or it's just an 8 acres that the city will allow to be subdivided.
Yeah. And if I remember rightly, the parcels were advertised at $10,000 a piece.
Yes, each of the regular lots.
Okay. All right. Thank you.
So I just had one question. Can you identify the tax lot that is Tract B? Because you didn't give us the subdivision map, you gave us a tax.
It's the big one in the middle there.
5,700?
700, I believe it is.
Okay. Yeah, it appears that it was, having done enough subdivisions, that rather than an open space lot, it was probably for the next phase and potentially subdividable, but, of course, they have to get through whatever land use rules are for that. But, so that's a pretty nice piece of property for $6,000, but again, I'd rather see this out in private sector being taxed versus us holding on to it for having and gaining no income and really being more of a liability. So just wanted to, for those that might actually want to look at the board packet, understand what Tract B really is actually tax lot 5,700. Any other questions for staff? Do we have a motion? Commissioner Lykin.
Thank you, Mr. Chair. So I'd like to move approval of Order 15-09-15-11, the matter of authorizing the sale of county-owned real property for $150,000 pursuant to a land sales contract to BJ Real Properties LLC for 27 lots on Roaring Rapids Way in Oak Ridge.
Second.
It's been moved and seconded. Is there any discussion to the motion? Seeing and hearing none, all those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. Thank you.
Thank you.
So we're still 15 minutes ahead of schedule. Here I was concerned that we were going to run overtime. I don't know if County Council is available to get to their item, or if we want to move to our time certain item early. Oh, here comes Sebastian, right on schedule. So, so we'll move down to county council. And first, under announcements, I will note that we actually have a split executive session. We'll go into executive session this morning before lunch and handle 3 items in that executive session, and then recess and come back into executive session time certain at 1:30 before we come back into regular session after that. Are there any other announcements from council?
None.
Then we'll move on to item 8B, which is the second reading and public hearing on ordinance 1506 in the matter of amending Lane Code Chapter 5. And we have Sebastian Tapia from County Council.
Good morning, Chair Bozovich, Commissioners. I'm here for the second reading of amendments to Lane Code Chapter 5. As I explained last time during the first reading, these are essentially administrative fixes to some inconsistent terms between the Lane Code and the Lane Manual. We brought the description of how to do the enforcement actions of Lane Code from Lane Manual into the Lane Code. Essentially, there aren't a whole lot of changes. There are some minor additions concerning providing some additional notice, particularly when the property owner is a corporate entity or some sort of a business entity. Otherwise, there aren't a lot of substantive changes here.
Questions for staff? Seeing none, is there a motion?
That's a hearing.
Sorry. My apology. I'm jumping ahead of myself. So, there are no questions. I'll open the public hearing for ordinance 1506. Is there anyone signed up to address the board on this ordinance?
Seeing none.
I don't believe so, seeing the only people in the room are staff. So I'll just ask real quick if there's anyone in the audience that wishes to address the board on this ordinance. Seeing none, I will close the public hearing, and we'll move on to discussion and motion. Commissioner Stewart.
Mr. Chair, I'd move approval of ordinance 15-06.
Second.
It's been moved and seconded. Any discussion to the motion? Seeing and hearing none, this is an ordinance. Will you call the roll?
Commissioner Sorensen.
Aye.
Commissioner Stewart. Aye. Commissioner Lykin.
Aye.
Commissioner Farr.
Aye.
Commissioner Bozovich.
Aye. Motion passes unanimously. Thank you.
Thank you.
That was quick. So we have about 11 minutes. Why don't we move on to county administration announcements?
Okay, Mr. Chair, Commissioners, I just have a couple things. I was going to introduce Greg Rickoff to you today, but he's in interviews for a senior management analyst position, so we've got him hard at work already, and we'll have him next week to introduce to you and the public. Also had an opportunity last week, Mr. Rickoff and I did, to meet with our deeds, records, and elections staff, and I wanted to give you just a quick update. We actually have an election today. September 15th. This is for an initiative in Cresswell, and about 2,600 registered voters, as I understand. We've been tracking, Elections has been tracking the recall effort for Senator Przanski, and I think as everyone has seen, that effort failed to secure the signatures required, so that will not happen. And we do have an election then on November 3rd in Eugene, Springfield, and South Lane Rescue. And then, of course, our staff is actively working on what we anticipate will be a very heavy turnout for the presidential primary on May 17th, 2016. In addition, our staff is working on the Oregon Motor Voter implementation, which takes effect, goes live January 1st, and so there's a lot of work that's going into that effort. And I'll invite Mr. Rickoff to come on up here for a minute, and I'll introduce him, and also just tell you that from deeds and records, we've seen an uptick in the number of recordings, about 45,000 recordings to date this year compared to the same time last year, which it was about 34,000. recordings that we had. We've done around 1,600 marriage licenses this year so far, 263 marriage ceremonies. In July and August, which is sort of the June, July, August are the peak months for marriages, we were averaging around 19 marriage licenses per day. So a lot of activity in our deeds, records, and elections operations, and of course we have a great staff who's doing wonderful work with limited resources, and really appreciate that. So we pulled Mr. Rickoff out of the interviews here to come down and just introduce you quickly. I know the commissioners have all had an opportunity to meet Greg, but wanted to have an opportunity for the organization and the community to see him and meet him. And we went through a national recruitment to fill this position of our Director of Operations to replace George Russell, who for the past close to a year has worked with us on an interim basis and helped sort of structure the department the way that it is today. And so we did this national recruitment, had a wonderful pool of talent, and Mr. Rickoff rose to the top of that process. And I think, as the commissioners know, Greg has spent around 17, 18 years with the city of Eugene, and the past several years with the University of Oregon, having served the past 3 presidents at the university as the Community Relations Director and as the Chief of Staff to the President, and actively involved in the community, and a wonderful breadth and depth of experience, and we're really excited to welcome Greg to our team. He started last week and went through orientation yesterday. And so the areas that Mr. Rickoff is going to be responsible for overseeing include deeds, records, elections, our county clerk function, the finance division, which is payroll, accounts payable, receivable, investments, services, parole and probation operations, and then a number of areas within county administration, including legislative affairs, community and economic development, and capital projects will be the responsibility for our Director of Operations. And so we welcome Greg, and happy to have you. And if you'd like to make any comments, the board would love to hear that, and any questions certainly the commissioners may have.
Thank you. Thank you for the opportunity to serve. It's been a great first week. Very impressed with the teams. The staff is, I think, to a person, exceptional, deeply committed, and I'm excited to get started.
Any questions or comments from the board? Commissioner Stewart.
Thanks, Mr. Chair. I don't have any questions. I just want to say welcome, Greg. I really enjoyed the last 10 years getting to work with you in your capacity at the University of Oregon, getting to do interviews and get to know you. You're going to be a great asset for the county, and I'm thankful for your consideration and taking the job.
Thank you very much.
Commissioner Farr.
You know, it was March 1995, and I was walking up the ramp into City Hall. I'd been there maybe 3 times before in my life, and Bobby Green had just become a county commissioner, and I'd just been appointed as a city councilor to replace Bobby, and I did not know where I was going. And Greg Rickoff was right there, and I didn't know who Greg Rickoff was, but I assumed he knew what he was doing, and it turns out he did. He guided me around City Hall that first day. I don't know if you remember it, and very shortly after I was appointed by Mayor Ruth Bascom to the Human Rights Commission, and Greg was the administrator, was the chief staff, and he had a fairly robust staff at the time. And it was a very eye-opening experience being on the Human Rights Commission, working with you, Greg. And I really want to thank you from that very first day, my first moment on the job as a Eugene City Councilor. You were there. You held my hand. Literally. I mean, literally. He was holding my hand this way. and we had some momentous occasions when we worked together. Over at the city of Eugene, and ups and downs, and really some turbulent stuff, but by and large we got a lot of stuff done, and you were there to lead a lot of the major issues that we dealt with in the 1990s, and there were many as we were entering a deep recession, and as we were recovering from but adjusting from Measure 5 still, and then adjusting from Measures 47 and 50. It was a turbulent time in city government, and thank goodness for me personally that you were there at the time, Greg. And now we're back working on the same staff on the same team. It really thrills me no end. So welcome to Lane County.
Commissioner Sorensen.
Thanks very much. Well, Mr. Rickoff, thank you so much for being willing to come here. I know the City of Eugene, the government of the City of Eugene, and the University of Oregon are two of the largest, best, most respected public institutions in our community, and I'm really glad you're joining our team here, and I hope that some of the good karma that you've brought to those institutions can be brought here, and I'm glad that you're here, and I hope that this is a good career move for you personally. I think it is. I don't really know because I don't exactly know what your job is, but I'm optimistic it is, and I really appreciate you willing to come here and work with us. And I agree with you on the topic of the team that Steve Mokrahysky is assembling here. I've been here for quite a while, longer than most of the people in the room, except for the chair of the Public Safety Coordinating Council. I've been here for quite a while, and I think that the group of people that we have here that Mr. Mokrahysky has been assembling in his short time here really have been some really top people. So I'm glad you're now one of them.
Thank you very much.
Commissioner Lyken.
Thank you, Mr. Chair. Well, Greg, welcome, and really appreciate it. Actually, Greg and I have been personal friends for many years, and which has actually allowed me to, I think, see his skill set up front and center. And Steve, very good, great choice, excellent choice. So, Greg, thank you for accepting this position and coming on board. And I really look forward to working with you. And I know just the work that you not only did at the City of Eugene, but really with the University of Oregon, and in a sense, having to guide, be the right hand of the university presidents. That can be very challenging, and I know that we've had a couple conversations about that in the past. So, but your skill set, though, I think will resonate very positive here. And so, welcome aboard, and again, looking forward to working with you.
Thank you very much.
I don't know if there's much I can add other than just to say welcome.
Thank you, Jay.
Thank you, Mr. Chair and Commissioners, for that. And I think we just have about 2 minutes. There was one last update I wanted to share because we've had a number of public comments over the past couple weeks here at your meetings related to the park master plan process. And so I just wanted to share a few comments with you. We did have the first public meeting and open house in Florence last week. I wasn't able to attend because I was at the Large Events Task Force, which has had 18 meetings over the past 14 months. And they're wrapping up their work, so I wanted to attend and address that group and hear the recommendations that they're finalizing. But we had a really good turnout in Florence. It was near close to a full room. I don't have an official count, but I'm going to say it's something in the range of 40 to 50 folks who showed up. The City of Florence was outstanding in helping us get the word out and make sure that people were aware of it. So we're starting to get good feedback. You may have seen an article in the Register-Guard. You may have seen an article in the Eugene Weekly. You may have seen an article in the Siuslaw News. You may have seen an article in the Mackenzie, is it the Mackenzie Times? Mackenzie River Times?
River Reflections.
Thank you, River Reflections, thank you. And Mike Russell, who has done a number of radio and other interviews. So we're doing a lot at, social media and other things to get the word out there. We will continue to do that, and we look forward to more public feedback through that process that will occur through October. And just a quick comment on the Large Events Task Force. Our plan, they're again wrapping up their work. They're going to have a couple more meetings here in September. And our hope is, after I have an opportunity to review all those recommendations, that we will bring them forward to the board later this year. That could happen in October or November. And then, based on board feedback and guidance, we will incorporate any of that work into the master planning process as necessary. And that has been 18 meetings, a lot of public feedback. I think I saw 1,255 comments we've received. in that large events task force process, not including the comments they take at the beginning and the end of the 18 meetings that they've had. So a lot of public feedback and input in that process, and I was really impressed with the quality of the discussion and the thoughtfulness of the folks last week in their work. So look forward to those recommendations coming forward. That's all I have.
Thank you. Any questions? Then I think we can move on to our time certain, jumping back to Order 1509 in the matter of approving the Lane County Behavioral Health and Criminal Justice System Plan. And I believe we have Lisa Nichols and Tim Lally here, and I will turn it over to you two.
Thank you, Commissioners. We're here today to present the Public Safety Community Health Plan that was developed over a series of months in the last 12 to 14 months, and basically I'm here to introduce Lisa. So,
Oh, you didn't stall long enough.
Oh, I didn't. So as you know, the intersection between mental health and public safety, particularly police services, is one that causes difficulty for all the parties concerned. It's recently gotten more national attention, but we've been working on this locally since, I think, 2014, and this report has a lot to do with what that intersection is like and what possibilities we may have to address those issues going into the future.
And we'll wait briefly for...
That's okay.
Mr. Chair, if I may,
Mr. Farr.
you know, Mr. Lowy, Councilor Lowy, you heard me talk about Greg Rickoff a few minutes ago. I'd be remiss in saying that you met with me actually 3 months before I met Greg Rickoff, or I'm sorry, it was more like 2 months. We met at the Downtown Athletic Club, and I thought, man, this guy is serious.
Not as much as I used to be.
Good morning, Commissioners. Sorry for the technical difficulties there.
If I can just ask you guys to turn the mic right towards your mouth, they're pretty directional. Thank you.
Is that better?
Thank you.
Thank you for the time today to talk about this very important topic, the intersection of mental health, behavioral health, and the criminal justice system. I'm going to start by walking us through the process that the group has been going through around examining these concerns, and then I'll move into the associated recommendations and proposed next steps that we're seeking approval for today. But first, I'd like to set the stage with some data on the national level. So it's been identified that more than 50% of the state prison populations and 64% of jail inmates meet criteria for having mental health issues. More than 60% of this total population meets criteria for substance abuse problems, and the recidivism rates for those with mental illness are nearly double than those without. These facts are adding up to a very ineffective and inefficient system that's adversely affecting the safety of our communities. To address this issue on the local level and contribute to the safety of our community, the PSCC adopted a motion in January of 2014 to create a team to analyze the gaps associated with the intersection of our behavioral health and criminal justice systems. Based upon this recommendation, we moved to applying for a Gaines Center Award that we were successful in, and this led to 2 consultants from the Policy Research Associates coming to Lane County to convene a day-long workshop dedicated to creating a sequential intercept map for early diversion. This workshop encompassed 3 primary objectives. First, create a comprehensive picture of how those with mental illness and co-occurring disorders flow through our criminal justice system. Second, identify related gaps, resources, and opportunities. And finally, develop priorities to improve our system. So this slide shows the visual of the sequential intercept map, illustrating how people with behavioral health needs touch our system at each intercept. The intercept starts with first contact and moves through initial detention and court hearings, entry into jail, re-entry to the community, and finally community corrections and supports.
In July of 2014, the Mental Health Summit, a group composed of behavioral health and criminal justice professionals, took on the responsibility of serving as the work group tasked with reviewing the SIMS information and further detailing and prioritizing system gaps and needs. The group started by creating a vision statement, goals, and values for the mental health, addictions, and community safety in Lane County. The proposed vision statement reads as, "We live in a safe community with a behavioral health system that provides whole person care with a focus on wellness and recovery in the community, incorporating appropriate integrated treatment and interventions at the appropriate time in a logical system with no wrong door. Our community is supported by a system and appropriately resourced infrastructure where entities delivering services are coordinated, connected, communicating, and collaborative for the benefit and well-being of the person needing care." The Mental Health Summit also identified broad goals for Lane County systems. These include ensuring that care is coordinated, it's easy to navigate, and offers multiple entry points throughout the system. So no matter where someone is at along that continuum of care, they can access the services that they need. The group finally delineated a list of core values that are applicable to our systems. These values are to serve as guiding principles as we move forward with our recommendations and solutions. Again, they center around the right to access and have available care at the right time, at the right place, that it's quality and evidence-based, and that the systems are talking to one another and collaborating for the benefit and well-being of our community members. Following the setting of the vision, goals, and values, the Mental Health Summit group then moved to a process of analyzing the system gaps and identifying and prioritizing potential solutions for these gaps. The group determined to break the solutions into two categories: those solutions that require little or no cost to implement, and then those other groups of solutions that will require additional resources and funding in order to move forward on. For the minimal to no-cost solutions, 3 priorities were identified. The first involved improving between primary care physicians and psychiatrists. Lane County, like many areas, is dealing with a shortage of psychiatrists and prescribers. The shortage is resulting in many individuals being unable to consistently access their psychiatric medication. To add to this issue, primary care physicians are often very hesitant to prescribe psychiatric medications. It's not their area of expertise, and they're not familiar with the litany of psychotropic medications. This can be alleviated, however, through coordination between primary care physicians and the psychiatrists that we have, through curbside consults and other mechanisms for education and opportunity to consult with one another. Primary care physicians can feel more comfortable prescribing these medications, thus increasing the availability to our community members. So to leverage the use of the psychiatrists and the primary care physicians that we do have in our area, it's recommended that we improve the coordination between these two practices and increase the availability of psychiatric medication. The second minimal cost solution pertains to providing information and, when possible, warm handoffs to people that are exiting the Lane County Jail. Information could include details on availability of treatment, appointment availability, and could move up to include warm handoffs, where providers are coming into the jail, meeting with people before they're released, establishing that contact and that relationship, and thus increasing the probability that they're going to continue treatment, that they're going to go to that other resource once they exit the jail and continue with their mental health treatment. Finally, the group recommended the reinstatement of the Lane County Impact Team. The Impact Team, at one time, was formed to bring together various organizations, including criminal justice, hospital, and provider personnel, to review and address the needs of individuals with mental illness that were having high and frequent contacts with law enforcement. This forum allowed for discussion and problem-solving in order to better help and serve these identified individuals, and thus pulling them out of that, cycling through the criminal justice system and pulling them into treatment. The team also identified priority solutions that are going to require additional resources and funding in order to implement. These solutions fell into a couple of different buckets, if you will. The first being around the delivery of crisis services. This area presents a significant gap in our current system with very few resources for individuals to access who are in crisis other than going to the emergency department or potentially jail. The team recommends the implementation of both a crisis respite center as well as short-term peer-run crisis housing. This could provide a resource for individuals to go when they're in crisis other than those two areas, and improve our systems, allow for the hospital, the ED, to be used in a more efficient way, in a more appropriate way. The group also identified that there would be a significant benefit from the addition of crisis teams composed of law enforcement and mental health professionals. These teams would respond to crisis calls related to individuals that are having frequent or high contacts with law enforcement. Such teams have been established in both Multnomah and Marion counties and have proven to be very successful in reducing contacts with police and assisting individuals with obtaining appropriate treatment and other needed resources. The second bucket of resource-driven solutions pertains to the need for additional housing options. Lacking housing provides for an instability that makes it difficult to deal with many other problems, including mental illness. Housing resources are needed for individuals exiting the Lane County Jail, as well as for individuals in various stages of their mental health treatment. The final bucket of recommendations pertains to the need for medication access, as well as services for specific populations. So as I previously mentioned, we have a shortage of psychiatrists in our area, leaving many without consistent medication access. It is recommended that local provider numbers be increased, and immediate access to these professionals be available. For specific populations, service gaps were found for both veterans and children and youth. Local veteran services lack intensive case management options, and the availability of mental health appointments for veterans is often very lengthy. For local area children and youth, there are currently no options for inpatient treatment. For children in need of such services, they now have to travel out of county if they're able to access these services at all. Statewide, there are huge waiting lists for such services, and many individuals find that they're not able to access them at all. There's also a substantial lack of intensive outpatient services for children in our youth in our area as well. So based upon all of these gaps and associated solutions, the work group recommends the listed next steps for action. These are to develop a work plan for each of the no or minimal cost strategies, to identify the status of each of these items. For items that are currently being worked on, and several of them are having much work happening, bringing these groups into the Mental Health Summit to report ongoing status updates, and to fold them into this group to further develop and implement solutions around these areas. Third, to continue to map the continuum of services and intercepts as they change and grow, and continue to identify how individuals move through the system so we can track their improvement and other efforts. Fourth, for those solutions which require additional resources, to monitor for grant opportunities and other resources that could start their implementation. And finally, for those items that are difficult to find funding for, examine potential collaborations with other federal, state, or local organizations. So we have reviewed these recommendations and this plan with both the Mental Health Summit Group and the PSCC, and they have been approved by these entities. We're now here to the board today to ask for your input and discussion and ultimately your approval so we can continue with this very important work. Thank you.
Thank you. Commissioner Farr.
Thank you, Chair Bozovich. I have a couple of questions now, then I may have a couple more follow-up after a little while. I'm looking at your list of recommendations, and clearly a great deal of work went into this. And then comparing it to solutions that you identified earlier, with both minimal cost and solutions needing additional resources. Clearly the ones with minimal costs are the so-called low-hanging fruit that we can take care of, presumably with close to the resources we have existing, or readjusting some of our resources. The coordination of primary care physicians and psychiatrists, for instance. We recently opened Riverside the FQHC. And when I was there, one thing that struck me is that in the past, quite frequently, if someone with behavioral health issues, mental health issues, had a physical ailment and they needed to be referred to behavioral health, they'd be sent across town, perhaps. Can you describe what happens at Riverside now?
We, at all of our Lane County FQHCs, have integrated behavioral health services into our primary care services. So we have a behavioral health staff member that is in each of the locations. The primary care physicians have access to that individual if they simply need a consult or have questions around a particular patient issue, or the patient can actually see that therapist and receive their behavioral health treatment at the same location. Additionally, at Lane County Behavioral Health, we've done a bit of reverse integration and integrated primary care into the behavioral health services that are offered there. So we have a primary care physician that's seen there. We have a team that's dedicated to really analyzing our patient population and trying to grab and capture those patients that have the highest needs, that have those health conditions that are negatively impacting their mental health condition and vice versa, and pull them into that treatment so in one location they can receive all of their health care needs.
And you've done that in both directions. You've done it both by adding mental health in physical health facilities and reverse health, adding physical health in mental health facilities. What a great step. And it seems that there's not a great deal of resource that went into that, just changing a few offices around perhaps, or when planning the new FQHCs, you've actually planned the hallways to be accessible. One of the physicians was pointing out to me how powerful it was for her to just send someone down the hall instead of sending somebody across the city or across the county even, and how great the incidence of people receiving that mental health care or behavioral health care, it's exponential. How the difference in between how many people actually received the care that they needed. And I'm looking forward to hearing more and more as you implement both the active system in physical health facilities and the reverse system in the mental health facility, seeing how, first off, the numbers of people who are actually receiving the follow-up treatment on behavioral health. The numbers that you talked about, 50% in our jails nationally are suffering from mental health issues or substance abuse issues, which are the same, really. I mean, I don't really think of them as being too different in the way we need to treat them. And 67% of the people in county jails are suffering from mental health. Now that points out something else that we talk about in solutions needing additional resources, and that is the housing issue. Putting people into stable housing, whether they're coming out of a jail or out of prison, or prior to them being sent to prison. Finding ways to make certain that people are in stable living conditions has to be one of our main priorities. And I'm glad to see that you're identifying that for people with mental illness and housing people prior to treatment. That's not something we like to talk about too much, housing people prior to treatment. Wet beds. It's not popular, it's not pretty, and it's not something that people quite often feel is the best way to spend our money. But in reality, I've been told that by helping people, giving people stable living conditions during their addiction and during their treatment for addictions is really there's no question that is the best way to help people through their addiction. And ultimately, would you say that I was going to touch a softball. It saves so much money downstream in public safety and in emergency room visits and various things. So Mr. Chair, I will have a couple more questions, but I really wanted to point out that you really have done a great job already, Lisa, since you came to work for the county, and in making certain that we are addressing the issues that we can address with minimal cost, with slight adjustment of resources available, and also identifying the things that maybe cost more, but ultimately are going to save a great deal of money, and more important than saving money, souls and lives. Giving people their lives back, or helping people to achieve stable and what we might call productive lives. So thank you very much, and what a great presentation. Mr. Lowry, thank you for your leadership throughout this, for I talked about 1994 when I first met you. You've been there ever since. You know, it's a rock of stability. Thank you very much.
Commissioner Sorensen.
Thank you. Regarding the first bullet point there, develop a work plan for each of the no or minimal cost strategies. Could you give me an idea of how many no or minimal cost strategies there are or there will be?
We identified 3 as a top priority.
Okay.
But of course, there were, we had pages and pages of items that were identified in the workshop and the work of the Mental Health Summit. So we went through a process of prioritizing our top solutions and recommendations.
Okay. What are those 3?
So those were the coordination between the primary care and the psychiatrists, better coordination between providers and the jail systems, coordinating that continuation of treatment, and looking at the reinstatement of the Lane County Impact Team, that multidisciplinary group that got together and tried to identify and help those people that are having the highest and most frequent number of contacts with law enforcement.
So those are the top 3, no or minimal cost changes. And what about the last bullet point, for items that are difficult to find funding? Now, is there something in between those 2, or is it kind of either or? Like no or minimal and don't have the money?
They are fairly extreme. So when we look at, the difference between coordination of current providers that we already have.
So we already have a budget to hire a person who's doing something, and now we're going to add on to their set of responsibilities that they're going to do some coordination.
Right.
That's minimal.
Right. And then looking at the other extreme, it's needing additional housing, needing to bring additional prescribers to our area. Those are solutions that are going to require...
Can you give us some idea of what this gap represents? Is it we could solve this problem just with the 3 that require no change in funding? Once we get that done, we're home free. There are no homeless people committing crimes. They're not in the jail. They're somewhere else. And I don't know, what is it? I read the other day. I'm doing the whip it and the nay-nay. That's how happy I am. Okay? And by the way, for you guys, you got to get on YouTube. 74 million hits on that. Anyway, so, Steve knows. He's laughing. So give me an idea what that gap is, seriously. Because if it's kind of small, then maybe we can find the resources. But if it's huge, and it's just not something within the current tax rate that Lane County's authorized, I would just like to get some sense of how big of a problem this is.
Let me jump in here a little bit. The problem is huge, and it has been huge for decades, and it has not gotten better for decades. In the last 2 budget cycles at the state level, local providers who provide mental health services and housing services for people with mental health have lost millions of dollars on an annual basis. So with the role of the no-cost provider or systems, yes, we can make a difference. We can make the system more efficient. Some of the costs related to housing, et cetera, are one-time costs or capital costs, but the operational costs are very extensive and ongoing. Plus, you have a social system in the terms of Lane County mental health and mental health services that reflects societal trends that are going on as well. So, no, I think it wouldn't be realistic to say that this is something that could be addressed under current resources or easily. This will be an ongoing incremental process that will take a lot of work and a lot of resources.
I mean, what I'm getting at is when we see a challenge around here, whether it was our parks measure that went out to the voters, which failed, or whether it was our transportation fee that went out to the voters, that failed, or whether it was our jail funding that was approved for 5 years, we tend to take action and at least let the voters make a choice. And I'm kind of getting at that with, are we going to try to have a strategy here of asking for grants, asking for other governments to pony up the money, or are we going to eventually get a strategy that looks to that last bullet point that would include something we have authority over, namely whether or not the voters of this county would ever be asked to be aware of the magnitude of the problem that Mr. Lowy is saying. I mean, I agree with you. I totally agree with you. But I question whether the strategy is such a great one, because I think it's one that we're already doing. We're already asking people to give us money.
Mr. Chair, Commissioner, we are having some conversations. I will say we held a meeting yesterday. Alicia and Lisa participated in that. We had City of Eugene, EPD, Eugene Springfield Fire, our sheriff, our district attorney, and so we're having conversations. And I think what's great is the work has sort of bubbled up from the Mental Health Summit to the leaders of different public safety and health and human service organizations. And so I thought it was actually a really good discussion that we had, and that everyone is at the table talking about how do we coordinate our services, and how, if we're going to identify some additional funding, which is really what's needed, how do we make sure that that funding goes into the areas that are of the greatest need, where the greatest gaps exist, and that have been demonstrated in our community or in other communities to have had the greatest impact on solving those challenges. So those conversations are ongoing between the agencies. Certainly, it's a conversation that the Board of Commissioners is going to need to weigh in on at some point here as we go forward. But we're beginning at least those preliminary conversations about how can we look at coordinating services. So it's not just going out and necessarily talking. We did this with the vehicle registration fee, if you remember. It was a regional approach. And I think that's the conversation that we're looking to have when we look at the need for funding services, that it's about our organization, but it's about our community and the regional need.
Okay.
Commissioner Stewart?
Thank you, Mr. Chair, and thank you, Tim and Lisa. First of all, I really appreciate the information that you provided today and the work that's been done. Thinking back when I first became a commissioner and I got on PSCC, one of the things that I really was hopeful and we tried to do was really kind of map the system. And I know this is specific to mental health and behavioral health, but it's really what I was hoping that we would have achieved, and that was 10 years ago. So thank you for doing that. And it's complicated, all the arrows and everything, but I think it really shows how complex our system is and how we're all kind of bound together and connected. So I appreciate that. Then the second thing I'd like to say is that, you list here 62 items that are, I guess, behavioral health system gaps, and it shows money. So that, I think, kind of quantifies what Commissioner Sorensen was talking about, the gap and what's needed. And what's significant for me about this, and I've shared with folks, that over the last couple of years, it really feels like we're actually moving forward with improvements instead of making cuts. And this work is critical because as we now start to see some of the community correction dollars being allocated through a grant process based on needs and everything, this really, I think, helps justify those requests and hopefully puts us in a position where hopefully we'll receive those funds that we've been trying to get over the years. So I really feel good about the process, and I feel good about the work that you folks and your entire team is doing. So I appreciate that. And I just kind of want to share one item that came across my desk this week. Yesterday I received it. And this will show that we still have a long ways to go. But I received a two-page letter from an individual that lives in a community that has a veteran that has some mental health issues, been in and out of our system multiple times. He burned his house down. He chose to do it himself. One day he was arrested 3 times in our system. Our system recognized that he needed mental health services. Took him to the hospital. He was released, and before he could get back out to his place of residence, was arrested a couple more times. That individual needs help. And the frustrating piece is we got, I know, at least 4 or 5 county staff people trying to get that person help. And we're not succeeding. And I hope that at some point we will be successful. Because the impacts is not only that individual is, my understanding, sleeping on a concrete slab, the remainder of some of his house that was there, spending some of his time in a shed that's still available. We all recognize those are terrible conditions, but then he's got a neighborhood that's concerned because of his mental health issues and the other things that are wrong with this individual in the neighborhood that, I think ultimately everybody wants help for, but in the short period, it's got a community, a neighborhood, and real concern for their personal safety and the individual's safety. So those are the things that keep us striving to bring in more dollars and be able to help these people. So ultimately, thank you for the great work, and I know that, in a lot of people's eyes, we would have liked to have done this immediately, but things take time, and I appreciate nobody's given up. I mean, Mr. Lowy, as Commissioner Sorensen said, you've been a part of this effort for many, many years, and I greatly appreciate that.
Commissioner Lyken.
Thank you, Mr. Chair. Lisa, first of all, thank you for the good work, and I would also echo the statements made about Mr. Lowy. Thank you very much for all your work involved in this. So on the slide, when I was looking at the piece of coordination between physicians and the psychiatrists, I think it's been a couple months ago, I think the board actually approved, in a sense, making us competitive. And can you provide maybe assessment of where we are today? Are we still what you would suggest, maybe a shortage in these areas? And in particular, on the psychiatric side, maybe just provide a quick assessment of where we are regarding that as far as the public health side is concerned.
Well, I can certainly speak to where we're at within Lane County Health and Human Services. We continue to have a shortage, particularly with primary care. We have made great strides in our recruitment. We have dedicated staff that have really worked very hard in this area to bring providers in, to open our new clinic that's coming online in the next month or so, as well as to fill the positions in our other community health centers. So while we have made great improvements, we still have those gaps there, and it'll continue to be something that we have to put more and more attention on. The competition is very heavy. We're trying to recruit people that are being recruited nationally, so the time and efforts of our staff are just far more significant than they have been in the past. We also have been successful with recruiting psychiatrists at Lane County Behavioral Health. We are very close to being fully staffed there in that respect, but I know our other area providers and nonprofits, particularly the nonprofits, continue to struggle in that very competitive market as well. To help alleviate in that area, we do have some measures underway using technology. We received a grant to purchase some telehealth equipment. We'll have that coming online, and that will increase the availability of being able to do those consultations between different prescribers, as well as eventually be able to potentially see patients via the telehealth equipment. So continuing to do what we can to fill those gaps, and I appreciate you recognizing that. While we've seen improvement, it's going to continue to be a challenge in the long run.
So another question, Actually, I view the timing of this to be really appropriate. As you know, our new performance auditor that we hired, after her risk assessment, this was, and as the board approved her to move forward on providing a good audit and risk assessment. So I think the coordination there can only be helpful on this. Question I have and so Alicia, if you don't mind coming forward, because you were part of the, with then Sheriff Turner and then DA Gardner in working on our 10-year public safety plan. I don't know if you have anything you'd like to add as far as, because to me, this really fits the bill. I mean, when we had the conversation with the auditor and the sheriff, the risk assessment, and the behavioral health and public safety, that combination is so significant. Do you view this, or is this part of the ongoing, what we have asked for a 10-year public safety plan?
Commissioner Bozievich, Commissioner Sorensen, yes, actually, in the 10 years public safety plan, there is a part for behavioral health, and it is that coordination. It is a system. You are absolutely correct. It's not a public safety system, behavioral health system. They cross over. And I'm excited about the work that the PSCC is doing and the leadership they're taking with our community to address those issues. This is part of it. And I think the next step is to say, where are the gaps, and if we had a little bit more, where would we put it to get the most effect out of the system? And we started a little bit of that conversation yesterday. Steve brought the group together, and the summit group is continuing that, and I'm hoping that it'll stay present with the PSCC. I know it will, actually. And I think that's our next step, and we need to do it pretty quickly, because whether we go for grants or we go for legislative fixes or we just look at how we make some small adjustments, we can continue to improve. And then will just be gaps in the system because of funding. There's no way that, I'm sorry, Commissioner Sorensen, I can't remember, was it whatever dance you were going to do? I don't think we're going to get there without, all that came to mind was...
Apparently, I'm not going to get to do it.
I will work hard. I have that commitment to see that dance, but... I think that we have to look at that and really be honest with ourselves about what we can do in our community with the resources we do have.
And then finally, earlier this summer at a Volunteers in Medicine event, I had the opportunity to sit right next to Randall Leary, who was, I guess you can still call him new, sort of, the new executive at Sacred Heart in Peace Health, Oregon. And one of the things I found from him is he's very passionate about this whole issue of behavior and mental health. And I know that you talked about the collaboration and coordination maybe with the public entities. If you maybe could comment a little bit about the ongoing collaboration that's happening actually with our local providers, and I know they're challenged as well as in the recruitment side. I mean, we've had that conversation with both Peace Health and McKinsey-Willamette, for that matter, that there's some challenges that continue to happen on making sure that whether it's nurses, whether it's the physician side, I don't know where they are on the psychiatric side. Of course, Peace Health with the Johnson unit, it sounds like to me they're also being challenged there. But maybe if you could make a comment about the coordination that continues to happen with the providers in particular, because I have come to the conclusion that the more we're involved with expertise, even on the outside, the better off we're going to be, making sure on our public health side is going to be very strong. So if you could comment on that. And before, and I'll let you go, but Lisa, I just want to say thank you very much for your leadership on this. Alicia, thank you very much for the extraordinary hire. And really with the work that's being done in Health and Human Services. And then I'll just leave that final question to you, and thank you very much.
Thank you, Commissioner Lycan. Certainly, coordination with Peace Health is primary in us being able to move forward on many of these initiatives, as well as all of our behavioral health providers and partners in the area. I think one of the strong points of Lane County is that we do have that collaboration and that coordination. We have a number of different forums where a variety of entities, whether it be behavioral health providers, primary care, law enforcement, hospital personnel, where everyone comes together and sits at the table and collaborates, talks about these issues, and discusses how we can move them forward, how we can work together to improve them. There's definitely a sense of shared ownership, and it's not a one-up where each organization is really thinking individually about their own. We're looking at the system as a whole and how can we improve it for our whole county and for everyone that lives here. So I do think that is a very strong point that we have in our favor moving forward in this very hard and complicated work that lies ahead of us.
Thank you.
So I'd like to jump in the queue here for a minute. I had an email exchange with former Commissioner Fleener this last week, and one of the things he made a statement was that I was a lock 'em up and throw the key away kind of person, and this board just doesn't believe in prevention and treatment. And I hope he's watching today, because one of the things I commented back to him was that he was uninformed. He probably is not aware that my stepfather is a psychoanalyst and my sister is a forensic psychiatrist, who I actually helped the Oregon health system, because once I moved out here and she saw how nice this area is, she moved out and now is serving the Benton County community with her primary care services and mental health. So, I'm a strong believer, and this plan is just, part of what we've been moving forward with. On the funding side, I really wish that the legislature had held to their commitments on House Bill 3194. They basically funded half of what they originally promised. If we'd had the additional funding in that grant program, which we'll see coming back to us again in a little amended form, but a lot of those programs integrate mental health with the criminal justice system. From the cognitive treatment programs in the jail that get handed off, post-jail. I really wish that they had fully funded that, and I'll continue. I spent quite a bit of time in Salem lobbying for full funding of that program, and I think it would have helped out. We may have to do some local funding as well, which I appreciate the administrator's work and everybody's work on coordinating, looking at future efforts relative to that. But we have made some strides. I mean, we've managed to get some expansion of the most secure beds in the Junction City Hospital opening. And we've even had a pilot project now with youth housing approved. At least we were successful with that in the legislature, the funding for that for foster youth in crisis and temporary housing. So we're working on some of those housing pieces in little spots. And Commissioner Farr covered something that I think is important. That's something we've been doing for quite a while now, and that's that co-location of mental health providers with physical health providers, and that easy, warm handoff between the two. But could you talk a little bit about the coordination with the new jail contractor, California Forensic Medical Group, and whether or not you've actually been working with them at all, and are they aware of this plan, and what kind of role they'll play in those, warm handoffs and some of those, what you considered no to little cost in connecting community services in the transition from the jail?
Yes. So thankfully, our partners at the jail recognize the importance of that collaboration. So we have been a part of this process since the new group came aboard. The group has a strong mental health focus, and we have been coordinating from their implementation around serving individuals in the jail, making sure that their mental health needs are met. We've seen improvement in the continuation of medication. When people leave the jail, they're given prescriptions so they can continue their meds once they leave. We're working on coordinating and doing those warm handoffs for continued treatment. Lane County has started the jail Intercept program. We have staff that goes into the jail, meets with individuals prior to their release, and then comes and gets them when they're released, brings them over to Lane County Behavioral Health and starts them immediately in services, make sure that their medication access continues, that there's no disruption to that. We're continuing to grow that program and work very closely with the new medical provider at the jail to make sure that we're continuing to improve those services and that we have that collaboration and connection. The methadone treatment program has worked very closely with them. Public health is working with them on a number of measures. Thus far, it's been an absolute great collaboration that I think we're going to see a lot of benefit from as we move forward.
Thank you. Commissioner Farr?
Thank you, Commissioner Bozovich, and thank you for that last question and your response. I'm really pleased to hear the way you responded to that, working with our new contractor in the jail to provide even better services than, whenever we contract with a larger company, one that perhaps does it on a larger scale than we do, we have an opportunity to tap into the resources that they have that we would never be able to generate on our own. And I'm looking forward to seeing how you use that greater resource in ways that really can help our prison population to reintegrate, the folks who spend time in the Lane County Jail and the folks who spend time in the state system, bringing them back into the community and giving them an opportunity to not have to go back. It's really exciting, and so thank you for that response. But I just wanted to point out there are so many different areas, so many different fronts that you're moving forward on right now. It's very hard to pinpoint a single one and talk about it because we're making progress in so many different areas. And I'll say again, since you came on board, you and I came on board kind of simultaneously, and I've had an opportunity to see things really grow tremendously based upon the resources that we placed into it. But specifically identifying the need for work in behavioral health areas, which once again includes substance abuse. And I'd like to point out something that Commissioner Lyken mentioned, and that is that we do have an auditor, a performance auditor, who has identified behavioral health as being our chief area of risk, not the department, but the funding for the department and the ability for the department to do the things that it knows it needs to do. And if we are and Commissioner Sorensen was talking about funding and how do we look at funding, how do we get funding, how historically have we received funding. Well, however we go forward looking for additional funding to provide the necessary services that are going to eventually save us a great deal of other resources down the road, we need to have the type of research and data that we're going to receive from the auditors assessment of our situation, and so that when we go to the legislature or we go to the federal government or we go to the public or we go to the nonprofits for help, we'll be able to say, this is the data that we have generated this internally. We're not making this up. These are real numbers. This is a real risk that is present, and we're at a really we'll be talking about our internal auditor, our performance auditor, later on today, ever so briefly, but it really is an area that gives us an opportunity to leverage the needs that we have in behavioral health and get more people listening to it, perhaps people that have never listened to it before. I'm seeing that throughout the community right now. People are beginning to understand that public safety and behavioral health go absolutely hand in hand. I was here last night. There was a Eugene City Council meeting that had, this room was absolutely full, out the door, spilling over into the Wayne Morse Plaza. And a lot of the folks were talking about housing and it was a particular type of housing. They were looking at camping is what they were talking about, but really it was a reflection of the general issue that we have surrounding the stability of housing in our community. When we see problems with people being unhoused, most of the problems are behavioral problems. I don't mind seeing people sleeping on the grass out there one bit, but I do mind when people are behaving badly. And people with behavioral health issues don't need to. If we can provide the kind of help to help them to not leave not leave a scar behind, so to speak. That's the kind of thing that diminishes public support for public housing, for housing assistance, is that they believe that some people are not pulling their own weight. Well, I personally believe that some people aren't responding to housing, responding to I hate to say fitting in with society, but being able to receive general support because of behavioral health issues. If we are able to address it, then we're going to begin to solve problems. And I'm just going to go back to housing just for one moment. Commissioner Sorensen was talking about how we've funded things in the past, and I'll dig back into Councilor Lowey's the past to the Council Committee to Finance Affordable Housing, the CISIFA. That was back in 1995, 1996, and we came up with a really great plan to finance $1 million stream annually for affordable housing. And it's at a point in time where, if you think there's a dearth in housing today, boy, back in '94, it was really, really bad around here. And this $1 million would have provided as many as 100 units a year, and it would have compounded. And we asked for a 1% utility fee. It was about $1 a month for the average home, and it failed by about 72%. It failed that badly at the polls. So when we look at asking folks to support our efforts in housing, which is having behavioral health efforts, I believe, we have to be able to demonstrate to them the return they're going to get on their investment. Back in 1995 and 96, we didn't articulate that very well. I think we're in a better position to articulate the return that people are going to get on the investment in behavioral health today. This coming Sunday, there's going to be a fundraiser for Square One Villages. It's going to be out at Sweet Cheeks Winery, and it's a paella fest. I'll talk a little bit more about it later, but it's helping Square One Villages. That is the nonprofit that is running the Opportunity Village project in West Eugene. It's working. It works really well, and if this nonprofit can leverage more help, then they're going to be able to provide the kind of housing that we're talking about, keeping people off the streets who need assistance, who need stability in their lives. We're not alone. It is daunting. If you look at it, if we're alone and you look at the magnitude of the issue, it is daunting. But if we take it one step at a time, one bite at a time, we house the veterans, we house the single moms, we house the kids who can't go home. If we start addressing specific areas and understanding that behavioral health has got to be a major part of how we address housing, then we're going to be able to articulate it in a way that everybody will support it. Because if you see it, you understand it, you are going to support it. So thanks again for all the help all the work that you've done, and the collaboration with PSCC, which PSCC itself, Tim, you could talk about the composition of the PSCC. I sit in that room and I'm just amazed at the power of the individuals that are sitting in that room at one table on a monthly basis. So it's daunting, but we have help. And if we can get more and more public help and more people to understand, then we're going to be able to do it. We're moving forward on so many different fronts, and I have optimism. Daily, I have optimism that we're going to be able to move forward and accomplish things on a regular basis. Thank you very much.
Mr. Chair, one thing occurred to me as we have this discussion, because sometimes things seem a little bleak in discussions like this, but Councilor Farr, or Commissioner Farr, brought up work that's been done over the last 25 years in housing issues, and we have made a lot of progress in the last 25 years in housing issues. The behavioral health issues in housing and some of the mental health issues in housing are some of the most intractable, but there have been a lot of housing built for single women with children. There is not near the lack of housing that there used to be 25 years ago in this community, and that's partly to the benefit of the Human Services Commission, the Board of Commissioners, the City of Eugene, the City of Springfield, but also the nonprofit partners in this community have worked for decades to provide housing. So there is positive here. This is a particularly intractable one that affects a lot of different services areas, but I do think we'll make progress on that as well.
Thank you. Any other questions? So we need a motion. Commissioner Stewart.
Mr. Chair, I'd like to move approval of 1509-15 2015-09 in the matter of approving the Lane County Behavioral Health and Criminal Justice System Plan.
Second.
Been moved and seconded. Any discussion to the motion? Seeing and hearing none, all those in favor, please say aye. Aye. Any opposed? Motion passes unanimously. Thank you very much for your work.
Thank
And with that, we will jump back into our agenda. We're at item 10B. I wonder if Shonda can make her way down here, or if she's aware. If not, maybe I can go to Commissioners' announcements real quick while she's making her way here. Are there any announcements from Commissioners? Commissioner Lyken.
Thank you, Mr. Chair. So yesterday at AOC, the Transportation Policy meeting, and then at the Legislative Committee meeting, we did adopt a letter, and in fact, I was pleased to see that with one single amendment by my vice chair on the committee, Mark Labhart, Commissioner Labhart from Tillamook, to, in a sense, make happy most of our commissioners in the room, we passed unanimously out of the Legislative Committee to send a letter to the chairman of both the Transportation Committee and the subcommittee, as well as the ranking member, which includes our own Congressman DeFazio, to send a letter in support of a transportation package. There is the U.S. Senate did pass a bill earlier, in effect, I think in July before recess, that called for a 6-year, which I think 3 years is funded. But I believe what we're looking at is really providing more flexibility, but also looking at not only flexibility with regards to local governments, but really focusing on improvements in our infrastructure and our road system as a whole. So they came out of AOC. I know this has really been strongly being pushed by the National Association of Counties as well. And just talking to our lobbyists back in D.C., it's extraordinary to think that there's a potential that we may get a transportation package in election year, which is really something to be said back in Washington, D.C. And it tells me that people really do understand how important this issue is for our country. And again, I don't want to harp on issues, but it's too bad that our own legislature couldn't see the same thing on how important this is. So we sent that out yesterday, and I was very pleased that it was unanimous. I was teasing Commissioner Lindsay from Lynn County. He even voted yes, and he said it was my fault that he voted yes, so I'll take that. But John's a funny guy anyway. But anyway, so I was very pleased with that, and so that's the only announcement I have. Thank you.
Any other announcements from the board?
Oh, do you want to do it now, or should we? I have several announcements, but I can wait until this.
I guess we'll come back to announcements then. We'll move on to our item B, which is the discussion, 6-month preliminary review and performance evaluation for the county performance auditor. And we have Shonda Miller here. And I don't know if you want to start things out or
I think I'll start with a few words.
Maybe let Commissioner Farr.
The only reason I feel okay saying I'll start with a few words is Shonda told me yesterday that I could, so so I will. A part of the packet today is a letter that came from the temporary performance auditor. It's called the Internal Audit Committee, and it gave a rundown on the things that Mr. Mueller is going to talk about. But I'd like to just mention a couple of things from the committee. The committee is currently made up of the voting members of Commissioner Lyken and me, Administrator Mokhaisi, Sheriff Trapp, and Budget Chair Dennis Hidgmans. And we also have Marcia Edwards, Christine Moody, and Council Dingle sits in on the meetings, along with Ms. Miller. Very deliberative committee. It's a little bit heavy to elected officials right now. The new committee when we recommend the makeup of the new committee, it will not be anywhere nearly so heavy to elected officials. It'll be mainly members of the community providing the direction for your office, Ms. Miller. But I just wanted to go to the very last paragraph of the letter that I sent and then turn it back over to Ms. Miller. This is a summary of how the committee has felt about Ms. Miller's work so far. And this is not an evaluation today. This is a progress report, more or less. The evaluation comes after 1 year on the job, which will be, there'll be more input from the permanent committee than from the temporary committee. So the committees discussed Shanda's work quality, breadth, and pace, and concluded that she has worked efficiently using resources available to an optimum level. Her interaction with staff at the director, analyst, and office level has been positive, accelerating her seamless integration into the county organization. Together with the committee, she has helped place us in a position to turn the governance of the county performance auditor office to a standing office over to a standing committee by January 2016. So the timeline is that by the end of this year, the temporary committee will be sunsetted, and a new committee will be recommended for the board to approve, for the board to actually make the appointments, hopefully by the start of next year, and when much of your work begins in earnest. So Ms. Miller, I'm through. Did I do okay? Was that fine?
Thank you, Chair Bozovich. Thank you, Commissioner Farr. I appreciate the letter from the Temporary Internal Audit Committee, and I'd like to briefly touch on some of the key accomplishments during my first 6 months. First, I took some time to do some strategic planning, developing a mission, vision, and set of values for the performance audit function, identified priorities and goals as well as key objectives and strategies for 3 areas of focus: improved service and performance, responsible management, and public agent. I also conducted a county-wide risk assessment that I used to identify high-impact and high-risk audit topics to develop a proposed audit work plan, which the audit committee weighed in on and the board approved last month. I also took actions to establish positive working relationships with commissioners, department directors, employees, audit committee members, and other leaders of the county. And I also worked with the Temporary Internal Audit Committee on, like I said, the proposed audit work plan, also the strategic plan, and on developing a recommended governance operating charter for the performance audit function, which the committee continues to do, as Commissioner Farr mentioned. I can pause there, or I can continue. I would like to recommend goals for the remainder of my first year, but I can pause here if anyone has comments or questions on the first 6 months.
Any questions from the board?
Real quickly.
I can.
Thank you, Mr. Chair. Well, as a member of the committee, I just wanted to echo Commissioner Farr's here at the very beginning, and really want to again say thank you very much for the work you're doing in such a short time. I mean, that's where I've been very pleased with in such a short time what you've already began to evaluate, bring together, and I mean, this is exactly why you were brought here to Lane County, and I'm just so pleased that you just put your track shoes on immediately and started sprinting. So it's something we've needed very much so. So thank you very much.
Thank you.
So I just want to note, one of the reasons why we reestablished the auditor's position here was to try and gain transparency and accountability for the community. And one of the things I'll note about your performance over the last 6 months is if there's anyone that's been transparent, it's been you, at least in our update meetings you've held regularly with each of the board members, I think, and keeping us up to speed on exactly what you're doing in your work efforts. We get a weekly update, I think, by email and personal meetings, I think at least once a month, if not more often. And I'll note that you and I are going to be in the city of Florence on, I think, October 1st as you start your Meet the Auditor meetings out in the community, and having the ability for the community to get to meet you and suggest possible audit topics or things that you might want to look into on behalf of the citizens to provide that transparency. So I just want to take a moment to appreciate the level of transparency that you've brought to your job and your commitment to it, and communicating that with all the board members and your outreach to the public that's just getting underway now.
Thank you.
Commissioner Stewart.
I guess, we just had our meeting yesterday, so a lot of this information has been presented to me, and I really appreciate, the work that's been done. Ditto the comments that have been said here about, very pleased with, the process, how you're organized, going through it methodically, and, we're going to have a real great foundation for your office to function with expectations from the committee and the board. Ours being met, so I appreciate that. And I too announce, she's done her internal assessment. Now she's going to go out and meet our community. We're trying to schedule one in Cottage Grove. I was supposed to report back to you, but the place that we were looking at potentially hosting a Monday evening event is closed on Mondays, so we'll stay tuned. But she is planning on being on the KND Beeper program with me, share the time on the morning of the 19th, and then hopefully we'll have an event in the evening somewhere in the community that can get out and meet Chandra. So thank you.
Commissioner Sorensen.
Well, thank you very much for coming today. I really appreciate all of your great work and service and positive attitude and riding your bike to work and showing some positive energy in this position. I wanted to also say that I don't know if we've put out any media on this, but it's not exactly a secret, but what's the day we're doing ours?
October 20th.
October 20th. Okay, very good. So, yep, there it is. So at 7 p.m. In the South Eugene High School cafeteria, Shanda Miller, performance auditor for Lane County, is going to meet the public, at least the public in the South Eugene district, and I'm going to be there with her to introduce her and to learn, and we'll answer questions from the public and tell them what you've been up to. I think this is a great idea, and I'm glad you've offered to do this with all of the commissioners, and it sounds like you're getting it together right away for West Lane and East Lane and South Eugene, so that is very positive, and I'm also pleased at the way this is kind of rolled out. I'm usually, one of my critiques is I'm in a hurry. I'm always in a hurry, and I feel like you're a very methodical, thoughtful person, and sometimes there's a clash between being in a hurry and being thoughtful and methodical. So I really appreciate how you are just, the Energizer bunny around here, just working. I really appreciate it. So thanks so much for your good service and continued work, and I'm really looking forward to the rollout of this more permanent committee.
Any other comments? Anything?
Well, so thank you very much, and while I feel like I have made good progress in the first 6 months, and I also wanted to recommend some goals for, I guess it's the remaining 5 months now. We're into 7 months, but so I just wanted to touch on some recommended goals. One is that my goal is to complete 3 of the 4 projects on the approved 2015-16 work plan. The first couple projects are fairly small administrative projects. One is to implement the operating structure for the performance audit function. This includes developing a procedure manual and implementing the fraud, waste, and abuse hotline. That includes developing policies and procedures and also some outreach and educational efforts for employees. before I start passing out the phone number. And then I'd like to conduct the financial indicators performance audit, and my goal is to have that be completed before the end of my first year, so middle of February. And then I'd like to initiate the fourth project, which is the behavioral health audit, which was mentioned earlier. And then, of course, continue to work with the temporary internal audit committee on a new and recommended governance operating charter for the performance audit function. Continue to build positive relationships with county leadership and employees. And then, as a few of you mentioned, I'm going to work on scheduling and participating in public informational events across the county to create more awareness about the role of the county performance auditor. And my plan, Commissioner Sorensen, is to get a press release out on Monday for those events. And in addition to these goals, I will continue to implement the one-page strategic plan that was also approved by the board last month.
Commissioner Farr.
Thank you. One thing that Ms. Miller hasn't really pointed out too much, but that I will point out, is that she adheres to a very strict set of standards that are prescribed by a couple of different auditing bodies. And can you describe that just a little bit?
Oh, sure. So one is the Government Accountability Office, which is the federal office. They publish government auditing standards that even local and state government auditors adopt as their own auditing standards. And then also a lot of local government auditors follow the Institute of Internal Auditors, sort of their guiding framework and principles, and I'm a member of that organization, so I'm required to follow their code of ethics, for example, and their framework for auditing. So
A standard that you brought with you to the job and that you adhere to. And I like the way you described it in the temporary performance audit committee, that there's a yellow book. I believe I'm getting my colors here right.
Yeah.
There's a yellow book and there's a red book, but there's also one that Shanda kind of adheres to, and it's the purple book, which is a little bit of a combination of the red and the yellow book, but both of which are strict standards that you don't deviate from, that when you're doing your performance audits, you're not shooting from the hip. You're going out with a very, as Commissioner Sorensen pointed out, very methodical and very deliberate in the way you do your work. And if, I've had a chance to meet with a couple of folks in the community with Ms. Miller, including Jack Wilson. We met with Jack Wilson last week, and Jack Wilson asks detailed questions, and I'm pleased to say that when Ms. Miller answers the questions, she always takes a few moments before she begins to answer. And to me, that is it's just an indication that you are very methodical and prescribed in the way you deliver your answers. That's the way you perform your work. The committee has been highly impressed. Across the board, we've been highly impressed with the speed that you've worked at, with the deliberation that you've worked at, and with the processes that you prescribed, including a hotline that is in the process of being implemented as we speak, and there are things in place in the county that we've never really had before. People say you've had an auditor before. Well, we've had auditors before, but we've never actually had someone who is skiing the fresh snow that you're skiing right now. It's we're breaking trail on a new type of audit position that really, as Commissioner Stewart has said, and Commissioner Bozovich both said, providing openness in government and the word transparency that so often comes out. That's the goal of your work. And I'm pretty excited, as it says in the last paragraph of the letter that I wrote, that we're on target to making a recommendation for a permanent or an ongoing audit committee. I'm excited about seeing their work and how they take the preliminary work that you've done and move it to the next level. We have great things in store for us. Thank you very much, Ms. Miller. Thank you, Mr. Chair.
Any further comments? So I appreciate you coming before us. Is there anything more that you need from the board? I think I kind of heard general support for your work plan and all the comments and the goals you're setting for the next 5 months.
Yeah, I don't think that there needs to be a formal motion, but just sort of head nods in terms of the goals that I've laid out for the next 5 months, for the end of my first year. Yeah.
I'll be the first to kind of nod my head and say I'm in support of that.
Yeah, I support your work.
Same.
too.
All right, great.
I'm still up in the air a bit.
Maybe add more to the list.
I think you can consider that unanimous head nods to move forward and really appreciate the great work you're doing.
Thank you very much.
Thank you. So with that, we'll move back to announcements. And I think Commissioner Farr had a couple that you wanted to get.
Yeah, there were a couple. I'd talk a little bit about Square One Villages. There's a fundraising event this coming Sunday, and Dan Bryant is the chair or the head of the group, the committee that's kind of directing Square One Villages. It's 501c3. As I mentioned, the Opportunity Village in West Eugene, which is a project that is working very nicely, is a project of Square One Villages. And the fundraising event that's taking place on Friday is going to help them to identify potentially other locations and potentially other sites for Opportunity Village-like housing situations, which may include some of the tiny houses that we've talked about so frequently and that we're beginning to talk about even more. Tiny houses which can be either foundation-built houses or can be fashioned out of more mobile housing units, shipping containers, for instance. So they're beginning their work. Like I say, it's a paella fest. Everyone's invited. It's going to be at Sweet Cheeks Winery, 5 o'clock on Sunday, and it's going to be a blast. I think last I heard is that Congressman DeFazio is going to be cooking paella. I don't know if he's going to be cooking it for everybody, but he'll be one of the paella chefs. And if you've ever seen somebody cook paella, it's really a form of art, really, cooking paella. So I've never done it, but I've watched. The other thing I'll mention is that Margaret Salazar is going to be visiting us this Thursday. Margaret is the regional head of HUD, of Housing and Urban Development. She's looking at some of the direction that we're going in Lane County, both in providing housing for veterans and in providing alternate means of housing. Once again, the tiny houses that perhaps are in some ways replacing the single wide mobile homes that Debbie and I lived in when we were first married. There were single wide mobile homes regularly available, which aren't available today. It's a form of housing that's inexpensive, that actually allows people to develop equity in the home that they're living in rather than just pay rent. So she's going to be visiting. We've not finalized the schedule, but she'll be visiting a couple of our rest stops, and she'll be visiting Opportunity Village while she's here. And she'll also have a chance to sit in on a meeting of the Poverty and Homelessness Board, which happens simultaneously with her visit to Lane County. So looking forward to that. And the only other thing I'll mention is that Operation 365 Veterans is moving forward. We've housed over 200 veterans, and we're moving toward what we call functional zero. That is, no new homeless veterans entering the system, a net zero of new homeless veterans entering the system. Our goal is to have 365 housed by the end of this year, and we are on target. That's a broadly spread effort. It's private, government, and nonprofit, all joining hands to make certain that this one small segment of our homeless population, the veterans, we're taking care of it. And as I mentioned earlier, we're taking care of it one section at a time. By housing veterans, we're certainly not taking care of the homeless or the underhoused situation that we have in the county, but we're taking care of that portion of it. And from there, we can transfer the skills, the techniques, and the abilities that we gain from housing veterans into housing other segments of the population. I've said, this is the third time today, I've said I'm optimistic and excited about the future. We're in a good place, and daily we're moving forward. Thank you.
Commissioner Stewart?
Thank you, Mr. Chair. I just wanted to take a moment to say thank you to staff. Start off with Devin, and then Lydia McKinney and Bill Morgan and our great staff out of Public Works. You may have seen the article this last Friday, I believe, that highlighted the safety improvements out at Raw River Road and Raw River Trail. It's well worth the time to go out and see those improvements. I was very, very impressed with the work that was done. And, you see pictures and stuff, and you don't really quite know how they're going to do it. But they did a great job. And, it just kind of goes to show that, we took a couple really bad incidences that drastically impacted our community at a high level, and we've been able to address it more than just the typical, we'll improve sight distances and we'll cut some brush. It was, our staff rolled up their sleeves and, put together a great plan, and that great plan was funded by the federal government. And this weekend we're going to have Cycle the Lakes, our local Rotary Club puts on the Cycle the Lakes event, bicycle event, and those folks are going to be able to do that event in a much safer manner this year. So, thank you, staff, for a great job.
Commissioner Sorensen?
Thank you. I just wanted to mention that last Friday was the 14th anniversary of September 11, 2001, and there was an interfaith service at the First Christian Church in Eugene, and I was one of the speakers at the event, and I just wanted to commend the people that put this together. It's a monthly event. It's always on the 11th of the month, so it's not necessarily on a Friday or on a Sunday or on any particular day, but it's always on the 14th, on the 11th, September 11th. And the people that put it on are volunteers from different faith perspectives, and it was everything from Lakota Indians to a professor of Judaic studies at the university to a mayor of Eugene or Lane County Commissioner, different perspectives of people giving their points of view on a particular topic. The topic for September 11, 2014 was forgiveness. So you had these different cultural perspectives on it. Arun Tokay is the editor of Stepping Stones magazine, which is an internationally acclaimed children's magazine that's published in Eugene, and he's a Hindu, and so he is one of the people that started this. Also, a Eugene police officer, Bill Harris, who is a Sikh, he also was part of the origin of this, and so this was their 14th year of doing this. Anyway, it was quite moving, and I'd recommend that the public take a look at it. It is they're videotaped, so they're available on their website, and I think it's said to be the longest surviving monthly September 11 commemoration event in the United States.
Any further announcements? So I'd just like to note also at AOC yesterday, the Legislative Committee also approved a letter to our federal delegation requesting action on federal forest policy, making note of the horrible fire season we've had this year in Oregon, and hoping that we can move forward on dealing with that. And last week I spent time in Austin, Texas with my father-in-law at the Texas 36th Division reunion for World War II, and September 9th was the 72nd anniversary of the landing in Salerno, Italy. And I met a gentleman there, Orby Ledbetter, who enlisted in the Texas National Guard at age 16 for an extra $1 a month, I think, or whatever it was, and was actually scheduled to get out when Pearl Harbor happened, and they canceled all, anyone leaving the service at that time, and ended up being part of this invasion force, which was the second largest amphibious landing in World War II, and one that is not really well known. And it happened the day after the Italian government capitulated, so everybody was predicting light resistance. And it ended up being one of the bloodiest battles of World War II, and Orby was actually taken prisoner of war that morning, shortly after getting off the boat on the beaches and making his way inland, and spent 19 months in the German prison camp system. Orby dwarfed me, was probably 6'5". When the Russians liberated his camp, he weighed 90 pounds. And it is amazing how humble all of those gentlemen that I met from World War II are, and just, it was part of they just did what they were supposed to do, and came back and then got married, led normal lives after some of the atrocious treatment, they had and atrocious situations they saw themselves in, and the conditions they fought in. All I can say is every time I get to attend an event like that with World War II veterans, I understand why Peter Jennings dubbed them the greatest generation. It just amazes me, these men and women from that generation, and what they went through, and think nothing of it. And I just, it was a great opportunity, and something that I'll never forget, and look forward to next year's reunion in San Antonio if I can manage to make it. So with that, we'll move on to agenda team requests and work session requests. Any requests? Commissioner Likens.
Thank you, Mr. Chair, and it's earlier from the earlier conversation today at the board. So I would just, and it sounds like there's a work session already scheduled. So I would request with the agenda team if we could just add that piece on, and just provide and I think providing an update makes sense at this point in time on what on the whole issue, or I don't want to say issue, but what's happening with Trillium, and since they've been bought out by another firm, and where we stand on that, and if we can just add that to the work session, I think that would be appropriate, and an update I'm good with. So if I get head nods on that, just to add that.
So is there head nods to support that? I'm seeing 1, 2, I'm seeing looks like all 5 of us are nodding our heads, so.
Thank you.
Any other agenda item requests or work session requests? Is there any other business of the board besides what's scheduled for this afternoon?
Are we doing the executive session now?
We're getting ready to go into executive session. I was just trying to clear the agenda of all of our items prior to going into that. So we're going to go into executive session now and try and deal with the first 3 items. We'll probably recess for lunch in executive session and reconvene in executive session for our 1:30 time certain item, and then we'll come back out in regular session to do our any action that we need from executive session, plus the rest of our agenda. So with that,
Mr. Chair, question, will when we come out of executive session this afternoon, will we remain in the BCC conference room?
no, I believe we'll be coming back down to Harris Hall. Let me just double check my yeah,
We don't specify.
we don't specify, but
Have our work session. No, actually, it says the conference room.
we're going to stay in the conference. Okay, good. Thank you for that clarification. So when we come out of executive session, we will go back into public session in the Board of Commissioners conference room, not Harris Hall, for those of you that want to come and watch in the audience. So with that, the Board of Commissioners will meet in executive session to conduct deliberations with persons designated by the governing body to carry on labor negotiations and to consult with counsel concerning the legal rights and duties of of a public body with regard to current litigation or litigation likely to be filed. This executive session is held pursuant to ORS 1926602D and H, which allows the Board of Commissioners to meet in executive session for the purposes listed above. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any deliberations during the executive session except to state the general subject of the session as previously announced. No decisions may be made in executive session. With that, we are recessed and will reconvene upstairs.